Not every thyroid swelling requires surgery. Many patients with thyroid disease can be managed successfully with medications or observation. One of the most common indications is a large multinodular goiter, especially when swelling continues to increase in size. Confirmed thyroid cancers almost always require thyroidectomy. Surgery is also indicated when the enlarged gland compresses nearby structures such as the trachea or esophagus, causing breathing difficulty, difficulty swallowing, or a choking sensation. A retrosternal goiter, where the thyroid extends into the chest, is another important indication. Ultimately, the decision depends on clinical examination, imaging, laboratory investigations, and the patient's overall health. The extent of thyroid surgery depends on the underlying disease. A lobectomy removes only one lobe of the thyroid gland. A hemithyroidectomy removes one thyroid lobe together with the isthmus. A near total thyroidectomy removes almost the entire gland, leaving behind only a very small remnant of thyroid tissue. A total thyroidectomy removes the entire thyroid gland. Today, total thyroidectomy is considered the standard operation for most thyroid cancers and many bilateral thyroid diseases because it significantly reduces the risk of recurrence and simplifies long-term follow-up. The choice of operation is always individualized according to the patient's diagnosis and surgical indications. If malignancy is suspected, fine needle aspiration cytology is performed to establish the diagnosis. Many surgeons also perform laryngoscopy before surgery to assess vocal cord movement and document the function of the recurrent laryngeal nerve. Successful thyroid surgery begins long before the first incision. Every patient undergoes thyroid function tests to determine whether the gland is functioning normally, overactively, or underactively. An ultrasound examination provides valuable information regarding the size of the gland, the presence of nodules, and any suspicious features. Let's briefly review the basic steps of thyroidectomy. The operation begins with a transverse cervical incision placed within a natural skin crease to achieve a better cosmetic result. The skin and platysma muscle are divided. Next, the strap muscles are separated to expose the thyroid gland. The superior thyroid vessels are ligated carefully while protecting the external laryngeal nerve. The inferior thyroid vessels are managed while identifying and preserving the recurrent laryngeal nerve. The parathyroid glands are identified and protected. Once all important structures have been safely preserved, the diseased thyroid tissue is removed. After meticulous hemostasis, the wound is closed in layers. Each step requires precision because even a small mistake can produce significant complications. Like every surgical procedure, thyroidectomy carries certain risks. The most dangerous immediate complication is post-operative hemorrhage. A rapidly expanding neck hematoma can compress the trachea and produce sudden airway obstruction. This situation requires immediate recognition and urgent treatment. Some complications become apparent only after the immediate post-operative period. Temporary recurrent laryngeal nerve palsy is relatively common and often improves over several weeks or months. Permanent nerve injury is uncommon, but results in persistent hoarseness of voice. Damage to the parathyroid glands leads to hypocalcemia, producing tingling, muscle cramps, and tetany. Another important complication is laryngeal edema, which may also interfere with breathing. In inadequately prepared hyperthyroid patients, surgery can trigger thyroid storm, a surgical emergency characterized by high fever, severe tachycardia, altered mental status, and circulatory collapse. Early diagnosis and prompt management are essential to save the patient's life. Following total thyroidectomy, patients lose their natural source of thyroid hormone and therefore require lifelong thyroxine replacement therapy. Some patients may also develop hypertrophic scars or keloids, although careful surgical technique helps minimize these cosmetic problems. Thank you for watching. If you found this video helpful, please like, share, and subscribe to Tooth Theory for more easy to understand dental concepts. See you